What do you see as the bottom line impacts for laboratories as the Affordable Care Act approaches full implementation in this coming year?
Well, I think, as we get closer to 2014, and by the way, it is phased in over 10 years, but the primary part of the Affordable Care Act will be implemented in 2014. I think we will have millions of additional individuals who have access to health care, either through their state Medicaid programs, and even though many states, or at least a certain number of states, probably won't start out accepting the federal dollars for Medicaid starting in 2014. I think eventually most of them will come aboard because they're going to get great, I think, resistance from their hospitals and health systems who really need that additional federal money, because the feds start out by giving 100% for Medicaid to bring new people aboard, and then ultimately it goes down to about 90%. And again, for philosophical reasons, such states like Oklahoma, Texas, Kansas, etc., so far they say they're not going to do it. But the way the Affordable Care Act is structured, the federal government will come in starting next year and actually start building health networks at the state level if the states won't do it for themselves. And then starting in 2014, that's when I think you're going to see the biggest impact. And that is, you're going to see a lot more of the probably at least in the neighborhood of 15 to 20 million new beneficiaries coming in for healthcare services. For laboratories, clinical and anatomic, that's going to mean a lot more testing. But I think it's a matter that we are seeing demographic trends in this country that really are going to result in just an avalanche of new Medicare beneficiaries coming on board. Just between last year and this year, we've added an additional, I believe, almost 2 million beneficiaries. We expect over the next few years, it's going to be well over 72 million Medicare beneficiaries by 2030. And again, when you have that many more elderly on board, they get sicker, they need more screening. So certainly diagnostic testing, I think, is going to be in high demand. The big issue, I think, for laboratories is not whether or not there's going to be enough demand for their services. I think the crucial issue is, what are going to be the payments for those services, and in what method will they pay? And that's, again, part of the Affordable Care Act. I think over a period of years, you will see a movement away from the traditional, again, focus on volume, focus on, procedures, and moving, again, much more to outcomes, quality, coordinated care, integrated care, and probably moving away over a period of time from fee-for-service medicine to whether it be bundling or some variation of that. So I think laboratories certainly are going to still have plenty of business in the years ahead, but the challenge is going to be getting themselves in a position that they can get reasonable reimbursement for the services they're going to be providing.